everyone. Roosh, fantastic lecture, really. And everybody who's given the lecture so far from my class, it's been really amazing. You guys are very inspirational people. So time to recalibrate that really quickly. But anyway, I'm Bryan. I'm one of the fourth years. If you guys didn't already know that, then don't bother talking to me before I graduate. I've also been called B-Flow during residency, but occasionally I've been called Dr. Tang, Dr. Tan, as well as Nurse Nico, who's been gone for about a year now. So I'm not really sure what to do about that one. We did share the same last name though, so it's somewhat understandable. Today I want to talk about mentorship in emergency medicine. Quick thank you to Drs. Willis, Dr. Hassel, Dr. Searle, and Dr. Kim for helping me with this lecture. The reason I picked this topic is because I really don't think that I would have arrived to where I am today without the incredible mentors that I've had throughout residency and without their guidance. I will say though that through my literature search about mentorship in emergency medicine, literally every article says that there's a paucity of literature on this topic. So while there is some meaningful information in this lecture, a lot of this will be about my feelings, which I guess maybe arguably has some merit. So this is me. This is me on my graduation day from this College of Medicine. As you can see, I'm happy, I'm smiling, I'm tan after traveling. I apologize to the current interns who couldn't partake in those activities. And I was really excited to start residency. I was really looking forward to obviously joining this renowned family. But underneath that happy exterior and underneath all that smiling, I was certainly very scared to start residency. I was kind of nervous about the challenges that were going to be presented to me. I didn't know if I would be able to rise to that occasion. And I had a lot of doubts in my head. It didn't really help when I realized that a bunch of my co-residents were pretty brilliant people. I remember going through Dr. D'Souza's EKG lecture and him putting up a bunch of pictures of EKGs on the slides, asking us what they thought what they were, not really having any expectations of us to get them right, but people like Chris Lim throwing out something called wandering atrial pacemaker, or people like Ben Weissman talking about RNT phenomenon. And I'm just sitting there silently thinking, where was I? Did I go to medical school? Did I sleep through the entire thing? Did I miss that page in first aid when I was studying for step 1? But fortunately, I had enough people in my class who set the bar so low that I was able to not feel like a complete imposter. Nevertheless, fortunately, when I started residency, I did encounter many mentors who have significantly helped me. They were able to help me build confidence when I felt like I didn't have any. They were able to create a comfortable learning environment, free of judgment and free of fear, which allowed me to properly learn and develop. They were able to effectively identify areas of improvement and provide constructive criticism. And most importantly, after the past 4 years, I can say that some of these mentors have truly become my friends. So I just wanted to give a couple of pretty simple and broad definitions of what mentorship is and what a mentor is. Again, if you search these things, you'll come across various number of definitions, but this is a pretty simple one here. Mentorship is defined as the process whereby an experienced, highly regarded, empathetic person, the mentor, guides another, usually younger or more junior individual, the mentee, in the development and re-examination of their own ideas, learning, and personal and professional development. And again, just a simple definition of a mentor here. A mentor is an active partner in an ongoing relationship who helps you maximize your potential and achieve your personal and professional goals. This bolded quote I like over here just because I think that it speaks to sort of the various ways that a mentor can help you. A mentor is a nurturer, a supporter, an advisor, an assessor, a developer of talent, skills, and knowledge in a relationship founded in trust. So this is a quote by some guy named Hendricks. I think he's a seminary professor. He has nothing to do with emergency medicine or medicine at all, but it's a nice quote. You can impress people at a distance, but you can impact them only up close. The reason that I really like this quote is because I think we can all familiarize or we can all identify with being in the position of really idolizing or admiring somebody. But the good thing about mentorship is that when they become your mentors, you realize that that same mentor and that same person that you idolize has actually gone through some of the same struggles that you're currently going through. So it makes attaining that goal and reaching that position that much more realistic. And so hopefully when you actually reach that same position, you provide the same kind of, confidence in somebody looking up to you. So like I had said in the beginning of the lecture, there really is a paucity of literature regarding this topic, and there are a few manuscripts specific to mentoring in emergency medicine. Of the surveys that have been done, 90 to 95% of medical trainees rate mentoring as important, or at least express an interest in developing a mentoring relationship. In a survey of program directors, a majority of program directors believe that mentorship is important to residents' career and professional development. And in another survey of academic EM physicians, 98% of these EM physicians cite lack of mentorship as either the first or second factor hindering their career progress. So another quote by, I honestly have no idea who. I really tried Googling the quote. I went back through all my references, trying to find out where I got it. I don't know if I dreamt it up, but again, a nice quote. Touching the heart of one may influence the minds of the world. Again, I think this is just alluding to the potential impact that you can have as a mentor and the legacy that you can leave behind. So there really are significant benefits of mentorship. For the mentee, mentored faculty more often endorse excellent career preparation. Mentored faculty have increased academic productivity in both research and an increased number of publications. Mentored faculty are more likely and more quickly to achieve academic promotion. Junior faculty with mentors are retained at a higher rate at their institutions or organizations when compared to junior faculty without mentors, who are twice as likely to leave their initial institution or organization. And lastly, mentored faculty score higher on career satisfaction scales overall. And for the mentors, some of the benefits are that you develop a strong network and a loyal base of proteges. You have improved technical expertise in whatever it is that you mentor in. You have improved longevity and have a lower likelihood of burning out. You have pride in developing the next generation, and you develop a renewed sense of purpose in your career. So very briefly, I just wanted to touch on some of the small but simple differences between informal and formal mentorship. Again, if you search these phrases, you can come across different definitions. But a simple one here is that informal mentoring is the natural coming together of a mentor and a protege, whereas formal mentoring is when an institution or organization develops a program and a process for mentoring to take place. Very simply put, informal mentoring, basically the organization or an institution matches a mentor and a mentee, whereas the informal mentoring relationship sort of happens more spontaneously and more naturally. This is not to say that an informal mentoring relationship can't develop into a more formal one, or that a formal mentoring relationship can develop into a more informal one, but this is more so just to give a broad overview. With that said, there have been some issues cited with formal mentoring. Some say that it is too hierarchical. Some say that intended outcomes are unlikely to be achieved when the surrounding work environment is too competitive and too individualistic. And some employees prefer mentorships with a more reciprocal and mutual character. This leads to my discussion of an informal mentoring idea or method called mentors of the moment. The reason I wanted to bring up this particular idea is because I think that we do this pretty well at our program. It was an idea that was brought up in the Harvard Business Review. Basically, mid and upper level ranking people, such as senior residents or attendings, seek opportunities in daily interactions to develop or grow junior colleagues and peers. So for example, during shifts, we try to enhance self-esteem, self-confidence, and a sense of belonging. We talk about individual successes publicly, so I think we do that pretty well in the clinical arena, as well as through our email listservs and through our group chats. We give and take feedback on shift, and we regularly assess culture and how it supports junior talent. So despite some of the benefits that come along with mentorship, there are still some barriers that impede developing mentoring relationships. Mentors or potential mentors cite a lack of time or lack of academic credit, lack of experience, or lack of confidence in becoming a mentor. And potential mentees cite a lack of time and a lack of being well matched as barriers to developing a mentoring relationship. More specifically, women and members of minority groups have more difficulty in finding mentors and are less likely to achieve major leadership positions or senior academic ranks, even when controlling for things like academic productivity or length of service. So some medical schools that have large constituencies of underrepresented minorities, these include Howard University College of Medicine, Meharry Medical College, and Morehouse School of Medicine. They don't have their own formal emergency medicine residency programs. As you can probably understand, this will probably decrease their exposure to emergency medicine and thus decrease the amount of mentorship they might achieve in emergency medicine. About 20 years ago, though, there was a partnership that was formed between Emory's emergency medicine program and Morehouse School of Medicine. Since then, more than 100 students have been able to complete the clerkship in emergency medicine at Emory's residency program. And from those medical students, 60% or more than 60% of those medical students have been able to successfully match into emergency medicine, with many of them going to Emory's residency program, and then the rest of them going to different programs across the country. So this is just to show that forming these kind of partnerships may increase the opportunities and exposure within EM for underrepresented minorities, and thus increase the number of underrepresented minorities who work in emergency medicine. Additionally, there's been a notable discrepancy in the equal matriculation rates of men and women into medical school when compared to the differences in rates of academic promotion as well as acquisition of leadership roles. When women were surveyed about this, women stated that mentorship, or more so a lack of mentorship and a lack of role models, as being key factors as to why they felt that this discrepancy existed. Back in the late 2000s, actually, there was a women-led mentorship program that was initiated by, in the state of Indiana across different emergency medicine residency programs. This women-led mentorship program was able to develop a supportive environment for women, both faculty and residents, to discuss different things, including both professional and personal matters. And after this program was initiated, they were able to rate the program, and many of them favorably and positively preferred the program. So hopefully programs like this can be initiated more commonly in emergency medicine programs, so that there's improved mentoring relationships for women. So creating a successful mentoring relationship. So these are just some ways to initiate and maintain a mentoring relationship. Finding shared goals or experiences. So whether that be through a shared interest in research, shared interest in being involved in academics or a particular fellowship program, you can use this as your basis and your foundation of developing a strong relationship. Find similarities that cross generations. So whether that be through similar culture, same gender, having family at home, you can use these sort of same similarities to, again, build a strong relationship with your mentor and your mentee. After finding these similarities and these shared experiences, you want to cultivate a respectful, collegial, and close relationship over time. And then after that strong relationship is built, you want to make sure that you keep each other in the loop and keep each other informed, because you don't want to sever that relationship. So some qualities of a good mentor. Make sure that you're sincere and make sure that you develop trust. Make sure that you're open and you're honest with your mentee, and that they know that you're there for them, so that you it's transparent that you want to be as helpful as possible. Make sure that you set a standard of integrity for the mentee to follow. Make sure that you're available, that you are approachable, that you give time to your mentee. Make sure that you're a good assessor as well as an acceptor. So not only give liberal feedback, but make sure that you can take feedback well. And be a believer and a supporter. Make sure that you encourage your mentees' aspirations and their goals, and don't necessarily just project your own interests and your goals onto the mentee. So at this time, I actually wanted to ask if anybody wanted to add anything to this list of what they thought would be a good quality and a good mentor.
So I actually just took an entire semester's long class on mentoring, master's, so I have a lot to say. But I think one of the best characteristics of a good mentor is kind of the ability to push. So one of the best reasons to have a mentor is that if you are, not necessarily if you're lazy, but like you are new, right? You don't know how to write a paper, you don't know how to make contacts, you don't know how to do these things. So a good mentor has the ability to say, oh, I'm putting you on this, or oh, I'm writing this paper with you, or you're coming here with me, you're coming to this meeting with me. So you can start to build those things. And as you said, it kind of creates a protege, or a fleet of proteges for the mentor. At the same time, that's one of the best ways a mentor can help a mentee is by being that push, being that start, or that ignition in all of those areas.
I would say, Bryan, wisdom. I think that, wisdom is something in today's day and age with the internet. We could jump on there, we could Google anything, and we could become, versed in that topic. But wisdom really takes a long time to develop. And I think to impart that to someone is priceless.
Yeah, I was going to say like experience and resourcefulness. Like if there's a question that your mentee has or something they're confused about, that if you don't know like, or have done that, at least have the resources from somebody you know, or that experience from someone else that you could provide them. So having those resources available.
Building on what Dr. Lucchese said, there's a lot of times when you don't have experience in something, but you know somebody who does. You could hook your mentors up with that person and have them get a new mentor in that topic. So make sure you stay within your realm of what you're good at and what you can mentor on, and share your mentors with other people who will make good mentors for them on a topic that you don't know about. It's very important not to like take on a role of something you can't do.
Definitely. Thank you. And then just moving on to some good qualities of a good mentee. So be on time and prepared. Remember that your mentor is sacrificing time to have this relationship with you, but also mentors know that your mentee is sacrificing time to have this relationship, and this is a two-way street. And be prepared for specific discussion points so that your time is used well. Be open and honest, so make sure that you talk about your strengths, your weaknesses, your fears, and your goals and your aspirations, so that your mentor has a framework and a context to help you best. And make sure that you stay in touch. After you've cultivated this strong relationship, you want to make sure again that this relationship is not severed. So I want to ask if anybody here actually had any suggestions for the qualities of a mentee that isn't listed on this board right now, or for anybody at home.
I think part of this is also being intentional. There's a difference between having a mentor and having an advisor and having a coach, etc. And these are different topics that you need to make sure that you're, as a mentee, that you are looking for that mentor specifically. So being intentional in your approach, and also sort of what was just said is you can have different mentors or different aspects, and knowing your limitations or no limitations of what's around you as part of the good quality of being a good mentee.
Be energetic and be ready to do stuff. I think that most mentors look at it as they'll trade knowledge for energy. And you can tell the mentee what to do, but they actually have to go to the website and like fill out whatever it is and like they actually do the work to accomplish the task. So just be ready to like come with energy and be ready to do a lot of stuff.
Thanks, guys. So this is the last quote that I have. Make no mistake, in the eyes of a junior, a senior position is a role model and a potential mentor. Whether or not a senior position is an exemplary one is his or her decision. I thought this was really important because I do really try to mimic the lessons that I've learned, the values that I've been taught from my senior residents and my attendings, and I try to promote that for sure to my junior residents. So these are some of the goals that I have as a mentor. Create an atmosphere of belief that each individual is working toward a common goal. Provide consistent sincerity and develop confidence to establish a foundation that allows guidance during difficult times. Demonstrate a standard of integrity for the junior to pursue. Show how to handle successes and mistakes gracefully. Be approachable, give time, and actively listen. And support strengths, strengthen weaknesses, and always encourage. So we're coming basically to the end of my lecture right now, but what I wanted to do to lead towards the end of the lecture was if anybody wanted to share any specific experience that they've had as either a mentor or a mentee that's been really impactful for them. What I can do is, of course, share my own experiences first. This is a pretty simple and brief experience, but it was certainly impactful for me. I remember when I was second year, it was, I think, May of second year, I was on my ED rotation. I had just been, I think, 4 months off service, so I was scared that I wasn't going to be as well equipped as I was previously. I may be a little bit rusty, but nevertheless, I went into my ED shifts, still trying to work hard, see a lot of patients, make sure that I was prepared for third year, which is coming in only a couple of months. But I realized through a lot of my patients, I was dropping the ball on certain things, I wasn't remembering certain things, there was some medical knowledge that really wasn't up to par at that point, and I was kind of getting a little bit down on myself, and I was a little bit bummed about that. So I remember it was an overnight shift, so I went to breakfast the next morning. I remember Derek and Duo Flake, so that was great. But Kelly, Dr. Morales, was willing to go to breakfast with me. And it was a very informal, obviously, breakfast, but he was able to share experiences that he had as a first, second, and third year, where things shook his confidence, especially when he felt that he was sort of on that upward trajectory of becoming a better resident. And it made me realize that, again, this is somebody that I look up to, somebody that somebody who's at a level that I certainly aspire to. It made me feel better that this person was also had also experienced these kind of challenges these kinds of obstacles in their residency. So it kind of goes back to that same point that I had before, where you can idolize and admire somebody and realize that they've gone through similar challenges as you. So it certainly still makes that goal of attaining that position more realistic.
I think something that I realized, and I feel like it probably stunted my use of mentors early in my kind of career and residency, is how much of a two-way street it is, and something that I always felt as a more junior person that I was kind of taking up the mentor's time or maybe, bothering them. But being on the other side of it as a mentor, you realize how much you get out of that relationship, and how it really, you learn a lot from your mentee and you develop yourself because of being a mentor. So I think that's something important for junior people, mentees to realize in a successful mentorship relationship. It's something that the mentor is getting something out of as well. And I think that does make it a little more allowable and make you feel a little better about using that time.
I think setting deadlines and setting meetings is really important, and you should do this at the end of every mentor and mentee meeting. Whatever you're going to accomplish, whether it's a project or just our next meeting, but as the meetings are closing, say, okay, we're going to meet again in 6 weeks or 6 months or 1 year from now, and pick a date and put it on your calendar, because this will keep you meeting and keep you guys connected. And by having a date set, it really has a deadline of what you're going to do during that time frame and for the future. But at the end of every meeting you have with a person, set a deadline for your next meeting. This way you don't drop off.
Anyone else have any comments or any questions at all? Or again, here it goes.
Sorry, I just have a lot to say about this. So yeah, as you said, mentoring is phenomenal. They've studied, they've surveyed many different medical schools, residencies, et cetera, all across the board. And basically, kind of the number one, the very high number thing that kind of contributes to a person's development is mentorship, right? However, the problem with mentorship is, as you said, like there's no time, there's no whatever. Like if I were to give you, I could teach you how to manage CHF, right? I could teach you how to manage diabetes. It's always the same. It's just tick marks. You kind of go down the pathway. There's no guidebook for mentoring, right? I can't give you something that says, this is what makes a good mentor. Because there are, as you kind of alluded to, there's many different styles of mentoring. Some people need a specific style of mentoring. Some people need a different style of mentoring. Some people need a longer term mentor, and some people need a shorter term mentor. And so all these things kind of combine to just make this a difficult process. The funny part about it though is that both the ACGME and the LCME require some sort of mentorship program to be credentialed. They leave it kind of vague, so you can be just, oh yeah, you can tick the box that there is a mentoring program, but that leaves so much wasted potential if it's just kind of like, oh yeah, it exists. What does that mean? Where is it going? And this talk is so important because we could have, they've done lots of studies also that show what basically is called faculty vitality. What faculty vitality is basically how active or how productive faculty are in a department. And so faculty that are happier with their jobs, faculty that have more output, right? More projects, more grants, more whatever. They also link that to, as you said, having a mentor or mentee. So if you as a faculty don't have a mentor that can help you do these things, you will blunder around, kind of not know what's happening, make some mistakes, maybe not do it correctly, get punished for it or whatever. But then secondly, if you have your own mentee to help you go through these things, not only does that help, as Dr. Rose was saying, help you feel better about yourself, it increases your longevity within the department, it increases your happiness in the department, and also increases your outputs. So the department loves vital faculty, faculty love vital mentees, and mentees love having vital faculty as their mentors because it helps everyone. So mentorship is fantastic and phenomenal, and it needs to be done more, and it needs to be done better. And basically, I think the most important thing is, like as Silverberg was saying, it needs to be intentional. If you just have someone who's there, it's like, oh yeah, you're not dead? Oh, you're not drowning? Okay. That's not a mentor. That's someone who's basically watching you to make sure you're not drowning, right? Maybe if you are actively drowning, they might throw you a lifeline and be like, oh, I'll work this shit for you. But like, that's not a mentor. And unfortunately for our program that we have, that's kind of what a lot of the mentors become. I was very fortunate. Dr. Willis was my mentor that I was assigned when I was a freshman, an intern. And so, especially now that I sit on this fellow, like our relationship has grown, and therefore I learned so much from him, and I hope he learns from me too. But I know not everyone is that fortunate. So I'm going to end all this. What I'm saying is basically, just to reiterate, this is a two-way street. Most faculty, if you are, as a mentee, are willing and energetic and say, I will help you on these things, they won't say no, right? If they have projects, they have whatever going on, they won't say, no, I'm not going to let you help me on these things, because that'll help them, right? That'll help you, that'll help everyone. And all of our faculty here are also very fortunate that they all genuinely are interested in your education and your career development. Maybe there's like two that aren't, but that's a different story. So if I'm working on something right now that'll try and help the faculty be better mentors, but this, like I said, it's still a two-way street. So if you have your mentor and you're kind of like, Matt, I really like you as a person, we haven't done much, reach out, text them, call them, do whatever, say, hey, we were assigned mentors, you do all these things I really enjoy and I really want to be a part of. Let's set up a meeting for next Tuesday and talk about how I can help you with this. And then, as you said, these relationships can be more formal, it can change to informal and kind of go back and forth within the life cycle of the mentorship. But it's going to take at least someone to start that first step and say, I want this, this is going to help everyone, let's go forward.
What Cal says is definitely true. It's a two-way street. And the more people you mentor and the more products you get out on people, the more your knowledge base grows and the better a mentor you will be. And the more stuff you will accomplish and the more stuff you will do. So it's really important to be both the mentor and the mentee. It'll really make you grow as an academic position and as a person.
Thank you guys for your input. So basically that's the end of my lecture. I wanted to do a couple thank yous as well. So first of all, thank you to my family, my brothers and my parents. Thank you for everything. You guys have been very supportive of me. I wouldn't have been here today if it wasn't for you guys. To my amazing wife, who I think is on this call, even though I asked her to not be on this call, but again, thank you for helping me with everything. You are all the best parts of me, and I wouldn't have gotten to where I am today without you. Thank you to all my amazing mentors here. I mean, honestly, there are too many of you guys to thank, but be sure that I will certainly thank you guys individually before I graduate. And lastly, thank you to my amazing class. We've been through a lot together, been through 4 years of ups and downs, some very unpredictable things, some amazing things. You guys are all, again, like I said in the beginning of this lecture, super inspiring, super motivational. I love you all, and I'm sure we will keep in touch as time goes on. And that's it. These are my references.
Awesome. Great job.